And I'll start with the new remedy today. Though I have not completed that particular remedy, we spoke of cicuta, if I am right. And cicuta, what did we discuss? What did we discuss in cicuta in last class? We spoke of mainly conversions. Mainly conversions. The mind part of cicuta is pending. Hopefully in next class I'll take up the mind. Today I'll introduce you to a very simple and a new remedy. Okay? So, just looking at this image that I am trying to show you, as a final year student, what comes to your mind? So what is the image that you see here? Very good. You see a respiratory system and you also see a GI system. Okay. So seeing respiratory and GI system, what is it that comes to your mind as a final year student? What comes to your mind? Okay, I mean you are talking of remedies, good. Mother is talking of remedies. It could be Pneumonia, a remedy acting on mucous membrane of respiratory and mucous membrane of GI. Possible. Okay, then apart from Pneumonia. As a medicine student, anything else that comes to your mind? Okay, it could be the sphere of action on the mucous membrane. Good. Beyond that, can you think of something? Can you think of something else? Okay, I'll just give a small clue. A nerve which is supplying to both of this. Okay, so very good. Pneumogastric nerve. So as a medicine student, as a physiology student, you also know that there is a common nerve which supplies both the respiratory and the GI, and that is pneumogastric nerve. Okay. So the remedy that we are discussing today is a remedy which is predominantly acting on the pneumogastric nerve. Okay. Now again, as a material medical student, as a final year student, recall the other remedies, which predominantly acts on the pneumogastric nerve. Which are the other remedies acting on the pneumogastric nerve? Laxatives, okay, good. Simple remedies. Pneumogastric nerve. Huh? Okay, pneumogastric nerve. I thought we'll have a blast. Unfortunately, okay, so we have two simple remedies. Antimonium tartar. And a remedy which is more simpler than antimonium tartar is Ipecac. The remedy which acts on the pneumogastric nerve is antimonium tartar, is Ipecac, and then you also have Carcovich. Okay, and you also have Pulsatilla. Okay, right? Pulsatilla. So the main focus of today's class is we are looking at a remedy which is predominantly acting on the pneumogastric nerve. From your first year, second year and third year material medical knowledge, we have three more remedies which act on pneumogastric nerve. Okay. So now quickly, for today's class, we will discuss the remedy, and the remedy that we are going to discuss today is Lobelia inflata. Now what is the information you know about Lobelia inflata? That this is a remedy which also has an affinity for the pneumogastric nerve. Okay? Clear? Okay. So we'll quickly look at Lobelia. Lobelia inflata is a plant, and this is also called as Indian tobacco. It is also called as Indian tobacco. Now the reason why it is called Indian tobacco is because it produces. Is tobacco over? Tobacco as a remedy, is it over? Third is a little bit another. Okay. So tobacco there main symptoms of very good, traveling sickness, yes, correct, great. So tobacco will have deathly nausea and vomiting. Deathly nausea and vomiting. Any symptom of tobacco, you will have nausea and vomiting. Okay. So what I want you to understand is, so this is what the source books give. It obtained the name Indian tobacco from the similarity of its action to that of tobacco in producing intense nausea and vomiting. So this remedy is also capable of producing intense nausea and vomiting. Okay. Now pneumogastric nerve. The only action that is highlighted in our books in Lobelia inflata is its action on the pneumogastric nerve. Okay. So we look at this. What could be the action of Lobelia on pneumogastric nerve? See, mainly it will cause excess accumulation of sputum in the lungs. And on the J, it causes gastritis. Okay. Through pneumogastric nerve, it causes excess mucus secretion of the lungs, and it can also act on the stomach at the J, and it causes gastritis, nausea, vomiting. Okay. So this is the basic introduction of Lobelia inflata. So hope I am clear. So this is what you need to understand. Lobelia inflata, a remedy prepared from plant. Okay. So we'll try to go further and we'll just see. The next important component we are discussing here is ailments now. And then Lobelia, what are all the causative factors? So remedy, Lobelia inflata. Okay, Lobelia inflata. So ailments now. So the first thing that you see is alcohol. You know better remedies? Sulfuric acid, good. Syphilinum, lacasis, naxomica, kali. When syphilinum in alcoholism? Good, very good. So what is that a syphilinum patient is going to tell you? Fine, sir, alcohol is in my blood. Meaning, when he says alcohol is in blood, what he is trying to tell you is, it is an ancestral property. Meaning my dad, my grandfather, great-grandfather, they were all great alcoholics. So it's come to me also. Okay, so the books tell you hereditary tendency for alcoholism is syphilis. Very good. And he was also trying to tell you about another remedy, sulfuric acid. What is the specialty of sulfuric acid? Okay. Yeah, I'll just modify the statement. Even water. See, sulfuric acid patient, if he has to drink even water, he has to add a little amount of alcohol. That is the craving sulfuric acid will have. Many ophidias, okay, protocols, lacasis, naxomica. Now why naxomica has a tendency towards alcoholism? Yeah, very good. So, naxomica is highly ambitious. Okay. To reach his goal, to reach his ambition, he needs stimulus. And alcohol is a stimulant that will stimulate him to keep him away and to keep him focused. That's what naxomica believes. So naxomica is again a very beautiful remedy for bad effects of alcoholism. For bad effects of alcohol. Okay. Next, so you also have rare remedies like Quercus. You will be studying in a final year or during your internship. Quercus is also a remedy which is given as a remedy to stop the what? Addiction. Alcohol addiction. For de-addiction. If a person is willing to stop taking alcohol but is not able to, then Quercus, sulfuric acid, naxomica, lacasis, based upon his constitution, based upon his reasoning, you can think of all these remedies. So, Lobelia also has alcohol as an element. It also has tea as an element. Elements from tea. Any other remedies? Diascoria, sepia, selenium. Bad effects of tea, tuja. Bad effects of tea. Okay? There are many remedies, but you should remember bad effects of tobacco. Okay? Any other remedies you can think of? Bad effects of tobacco. Say first remedy will be naxomica. Okay? Now what will happen in ignitia? Very good, ignitia. Agreed. Ignitia will not tolerate the smell. They are very, very sensitive to tobacco smell. Ignitia. Sensitive to tobacco smell, ignition. So, and getting feet wet. Ailments from getting feet wet. Better remedies? Pulsatilla, Restox, Aconium, Conium, many remedies. Now here, in this particular remedy, getting feet wet will cause amenorrhea. Like Pulsatilla, like Restox, like Aconium, getting feet wet will cause amenorrhea. Okay. Moving ahead, you also see that it's a respiratory remedy. So you will also see ailments from exposure to cold. Exposure to cold causes complaints, ailments from. And the last ailment here is suppressed eruptions. Suppressed eruptions or suppressed discharges. Okay. Now before I forget, in Lobelia inflata, suppressed photoria will give rise to deafness. Make a note. Because there are only two remedies mentioned in our materia medica. Suppressed photoria, meaning the patient has asthma, CSOM, okay, and assume you take some antibiotics or you take some, you put some drops, CSOM is gone. Okay. In the bargain, the patient starts hardness of hearing. The remedy will be either Lobelia inflata, and the only other remedy mentioned in the materia medica is lycopodium. Okay. Deafness by suppressed discharges or deafness by suppressed eruptions. Lobelia and lycopodium. Very important. Suppressed photoria. Okay. So I hope ailments are clear. 6 ailments, and if you just observe all the 6 ailments, it makes sense keeping the sphere of action in mind, because you see the remedy acting on the GI and you see the remedy acting on the respiratory. And one symptom related to the female genitalia, and that will be amenorrhea after getting feet wet. So these are the ailments, and then we'll move further. Before I move further, 2 important headings we spoke. First thing is the name of the remedy. Name of the remedy is Lobelia inflata. And I just gave you a small introduction, and I told you the common name. Common name is Indian tobacco. And why was it called Indian tobacco? Because it had an affinity to produce nausea and vomiting like tobacco. Okay. And then we also saw that the sphere of action through pneumogastric nerve, it mainly affects 2 areas. One is the respiratory tract and the other one is the GIT, gastrointestinal tract. And again, gastrointestinal tract, I will be explaining it now. You will see that it has no affinity for the lower J. It mainly affects the upper J. What you see is mainly affects the stomach and other areas. So, we'll be looking at GA. Now before GA, I gave you some 6 ailments. What were those 6 ailments? Alcohol, tea, tobacco, getting feet wet, suppressed photoria, or eczema. Okay, and then the last thing we also spoke was exposure to cold. So these were the few ailments. Now we'll focus on GA. As a final year student, what could be the possible action of Lobelia on GI? Here, Madhur. Very good. We just saw that it causes gastritis. Okay. Now we'll go in a very systematic way. As I just explained, it mainly affects the stomach. Okay? So what do you see in stomach? It mainly causes acidity. There can be excess hydrochloric acid secretion. Better remedies? Netrophos is good agreed. Netrophos. As a final year student, you should also remember Ropinia. Okay, which also has a tendency to produce excess hydrochloric acid. Ropinia. Given in Boric, given in Clark, you can refer. See, first very important thing, action of Lobelia on GA through a nerve. And what is the nerve? Pneumogastric nerve. And it is causing excess secretion of hydrochloric acid. And three very important ailments which can trigger GA affections will be alcohol, tea, and tobacco. Okay. Now, very important for you is what can this remedy produce? Very important. See, because if 10 permits will take up comparison. See, you have asthma, you have Lobelia, you have metal, okay, you have sulfur, you have arsenic, phosphorus, etc., etc. But each of those remedies acting on the GA can produce symptoms accordingly. Okay. So what you see here is, you see here that it causes acidity. Okay, so there is bad burning, acidity, heartburn with profuse flow of saliva, frequent rising with accumulation of water in mouth. So there is irritation, wherein there is sour, burning irritations coming up, and heartburn with profuse flow of saliva. So this is important, first part. And second very important thing, you would have already had a wild guess that what can this remedy cause on the stomach, keeping the common name in mind, is nausea. Nausea and vomiting. The word they use is intense nausea and vomiting. Okay. Now before I start telling you about Lobelia, can you think of any other remedies for nausea and vomiting? Colchicum, very good. Ipecac, good. Agreed. Populus, very good. Correct, good. Sepia, good, no problem. See, you need to be confident. Good, sepia, absolutely right, I'll come to it. Sepia, populus, colchicum, tobacco, ipecac, good. Now when sepia? Sepia, good. Smell. In sepia, smell of cooking, okay, smell of food can cause nausea. Sepia is a beautiful remedy. And then you are talking of colchicum. Egg, meat, fish, good, agreed. She has given you the clarity, what food can bring in nausea. But important for you in colchicum is they are very, very sensitive to odor, hypersensitive to smell. I don't know if I have shared this case. Long back, there was this case of a lady. It should be more than 15 years now. One of, the student of the same college he had referred. He is now a very great practitioner. Now his friend's wife, she had hyperemesis gravidae. Okay. Now please understand the situation of the case. In this case, what was the problem is, see, they did not, she is a known case of thyroid, hypothyroid, and twice before this she had aborted. Please understand, twice before this she had aborted. You know the reason why she had aborted is bad nausea, bad vomiting. She could not even take the eltroxin tablet. Okay. And in her case, taking eltroxin was very important to continue pregnancy. This is the only simple situation. Okay. Hope I am clear. So what was the situation? She is a known hypothyroid. She is conceived. She had also conceived in the past, but aborted twice. Why did she abort? Because she was not able to take eltroxin, which was required to maintain pregnancy. So even the gynecologist had given her some antiemetics. The tragedy was, she could not even take that tablet. Okay, the moment she takes, she starts vomiting. And again she was very hypersensitive to smell. And sitting in front of me, way back she was trying to tell, sir, now if I imagine food, now if I think of food, this second I can vomit. Okay? And the case was some almost 15 to 18 years old case. And one remedy that came to my mind there was colchicum. So if you read Allen's keynote, very nicely highlighted, thought of food, sight of food brings some moment. Okay? So further we had given Kochikam. And luckily and beautifully Kochikam helped. And she could continue her pregnancy, meaning after Kochikam, she was able to take altoxin. That was the only reason why one of our students suffered this case, because she was not able to even retain altoxin. Little water, altoxin, she would just throw it out. Okay, so Colchicum, beautiful remedy. Colchicum, sepia, and you are also talking of cocculus. What is the beauty of cocculus? When do you think of cocculus in nausea and vomiting? Range or traveling sickness. Traveling sickness. Common scenario, many of them come to our clinics. Sir, small distance car, I start vomiting. Okay. If symptoms are great, you can think of cocculus. Very important remedy. Ipecac. Ipecac also has intense nausea. Intense nausea. Excessive nausea. What is the hallmark of ipecac? Nausea with respiratory complaints or nausea with gastric complaints. Nausea associated with clean tongue. Don't forget this. Nausea associated with clean tongue. Thirstless, chilly. Ipecac. So you should know the peculiarities of each remedy. It can do wonders. Okay. Any other remedy that you spoke of? Sepia, cocculus. Okay. And tobacco. When tobacco? Tobacco also has intense nausea, vomiting. But there is a peculiar symptom in tobacco. It can be given for renal colic, it can be given for any colic. But what is that? Burning wants to uncover abdomen. Patient, during colic, during vomiting, during nausea, he wants to uncover abdomen. That is peculiarities of tobacco. So it's very important to know. So we'll come back and we'll try to understand what happens in Lobelia. What is peculiarities in Lobelia? See, Lobelia, extreme nausea and vomiting, faintness and weakness of epigastrium. Very highly spoken about in E.A. Farrington, in Boris, in Clark, all stalwarts. They talk of Lobelia, and you should have all these concomitants. Extreme nausea and vomiting, faintness and weakness of epigastrium, profuse sweat and prostration, nausea and vomiting during pregnancy. Nausea and vomiting during pregnancy. Any other remedies you can think of? No. Beautiful. That's the remedy I wanted. Symphory corpus racemosa. A rare remedy, but when you don't have any indication, I repeat it very cautiously, because for us it is similia similibus curanter. We cannot go against our principles. If you are not getting anything, then you can think of symphory corpus racemosa for morning sickness. Very important. Okay. See, the next line is very interesting here. What is it? Nausea ameliorated little drinks. Okay. For example, they have nausea and they are eating or they are drinking small quantities, they feel better. And nausea aggravation hot food. Nausea aggravation hot food. Better remedy? Nausea aggravation hot food. I have two questions for you. Nausea aggravation hot food is the first question, and nausea amelioration hot food is the second question. First question, she has got the answer. Second question also they have got the answer. First question is nausea aggravation hot is phosphorus. Phosphorus. Phosphorus cannot tolerate anything hot. Okay. Vomiting, nausea, aggravation hot is phosphorus. First. And second thing, nausea or vomiting better by drinking hot. The top remedy is chili. The top remedy is chili. Clear? Top remedy is chili. We'll go ahead and see flatulence and shortness of breath after eating. Please keep this point in your mind. It's very important. We'll discuss. What is this? Nausea, flatulence and shortness of breath, aggravation eating. So what is it giving a clue? In the next slide, we will take it further. What is it? What is the clue this particular statement is giving us? What is the clue this statement is giving us? Okay, very good. So next we'll be taking it further. Flatulence and shortness of breath, aggravation eating. So it's a very good remedy for gastric asthma. It's a very good remedy for gastric asthma. Okay. So heaviness, putting pressure on the diaphragm, putting pressure on the lungs, and difficulty in breathing. Okay. So any quick questions? So mainly GIT is our first focus, and second thing is we will be looking at the respiratory. Okay, respiratory. The quick inputs from the knowledge of pneumogastric now. It mainly acts on the lower respiratory. Correct now? So you don't have sneezing, you don't have coryza, you don't have upper respiratory tract complaints in Lobelia. You may have lower respiratory tract complaints. Now this clarity is very important. This clarity is very important. And there are certain remedies which can affect both upper and lower. And there are certain remedies in which symptoms starts from the upper respiratory tract and then it goes to the lower respiratory tract. Sir, I started with cold 2 days back. Now I have cough. And I know from my past, if I just leave it for 3 days, I'll end up with wheezing. Now what is the pattern you are getting here? So complaint started in the upper respiratory tract, mugida shuru aitu, it is going down and it is settling in the lungs. Okay. When you have this kind of a pattern coming up, you have different set of remedies. What remedies can you think of in this situation? There are some 18 remedies, and the remedy that you should remember, top remedy is Pneumonia, and top remedy is phosphorus. Where the upper respiratory tract infection starts first and then it goes to the lower respiratory tract. Okay. When the lower respiratory tract is directly attacked, I am giving you one more situation. What is the situation? When the lower respiratory tract is directly attacked without affecting the nose or the upper respiratory tract, then the remedy is tuberculin. Then the remedy is tuberculin. Clear? When the lower respiratory tract is directly attacked without involving the upper respiratory tract, the remedy is tuberculin. Okay. So we will just try to understand what are the probable respiratory complaints in Lobelia. So what you see here is, it can affect the larynx, it can affect the throat. In throat, what you just see from the image is, there is a tickling sensation. Okay. So when we talk of tickling sensation, what are the other remedies that should come to your mind? Okay, HEPA, good. HEPA, a better remedy is Rumex. Rumex, beautiful remedy. Itching in the throat pit, and this itching will cause cough, is Rumex. Again, some 18 remedies are there, or 17 remedies are there. But from my practical experience, what I have seen is, Rumex does wonders. When you are tickling in throat, leading to cough aggravation, lying down, cough aggravation, cold air, this small totality is Rumex. Now coming back to this particular remedy, you have tickling in the larynx with frequent fits of cough. So this is one. And second very important thing is lot of respiratory affections, meaning they can have breathing issues, they can have heaviness in the chest, breathing issues, and this dyspnea from constriction in chest, aggravation, exertion, but amelioration, rapid walking. See, they feel dyspneic, they feel difficulty in breathing, and this difficulty in breathing is better by rapid walking. Okay. One more rapid walking. Lobelia. Dyspnea better by dancing. Severe. But dyspnea better by dancing is severe. These are all there in islands and you should be thorough. Dyspnea better by dancing. Okay? So what you see is difficulty in respiration, obstruction in the chest, short fullness in the chest. These are few symptoms pertaining to chest. The more important, as a final year student and budding practitioner, what you need to remember is it's a beautiful remedy for asthma. Asthma. And I already gave you a clue. The type of asthma that you have in Lobelia is gastric asthma. So what do you understand by gastric asthma? Huh? Yeah? Good. What do you understand by gastric asthma? So asthma which is of gastric origin, meaning after eating, you take some rich food, you eat, after eating, there is a trigger in wheezing. Okay. So gastric asthma, right? Very important. And gastric asthma or asthma in Lobelia. See, this is, I should have used black here, but anyway, asthma preceded by pricking all over, even to fingers and toes. So this is a very peculiar symptom of Lobelia. Asthma preceded by pricking all over. Okay, they have this pricking sensation all over. Even in fingers and toes, they have pricking sensation. Okay. So here again, the print is not clear, but I'll read it for you. Asthma chiefly with gastric symptoms. We saw that. Gastric asthma and sensation of weakness in the pit of stomach. Sensation of weakness in the pit of stomach. Asthma aggravation, slightest exposure to cold. Eating, especially warm food. Opposite of? Correct. Opposite of arsenic. Arsenic is better by cold, warmth. Aggravated by cold food. Okay. Here, asthma aggravation, eating food, especially warm food. Lobelia. See, dyspnea and asthma with sensation of lump in throat with nausea and profuse salivation. See, what I want you to understand is, see, it shows the involvement of J also. See, like for example, there is dyspnea and there is also profuse salivation and there is also nausea. So what you see is there is a blend of two systems, the respiratory and J. That is important. Respiratory and J. Okay. I was referring yesterday, for today's class, there is something few authors talk of, and they talk of psychogenic asthma. Psychogenic asthma. We are talking of gastric asthma. And Lobelia also has psychogenic asthma. Now what is psychogenic asthma? Yeah, your friend is right. When you have asthma which is triggered by emotional factors. Okay. Anxiety. And again I was searching in Google for you students. This is an irregular breathing pattern with shallow rapid breaths. The breathing is usually thoracic instead of typical quite abdominal breathing. It is associated with transient giddiness, palpitation and tremors. The last statement is very important. This is usually manifested of acute anxiety. So whenever you are anxious, the respiratory muscles, they go into spasm and you start having, you have started breathing heavily. And he says it is more of the thoracic breathing. Okay? So psychogenic asthma. Asthma of emotional trigger. Asthma of gastric trigger. Gastric asthma. Image that I am trying to show you, that it can also be a remedy for pneumonia. Pneumonia but pneumonia. And can anybody take a wild guess what is the surprise remedy? Okay, Calicut is there. Good, it's there. I am asking you the surprise remedy, and the surprise remedy is chelidonium. Now why chelidonium? Why chelidonium? Because chelidonium, from our knowledge, we know that it's a very good remedy acting on the liver. But if you read chelidonium, it is also highly spoken of for pneumonia of right lung. Pneumonia of right lung. Very, very important. Yesterday we had a case of a lady with, and that's why it's very fresh in my memory. Last night we had prescribed chelidonium to a lady who had jaundice. You know, her bilirubin levels are quite high, and she also had right lower lobe pneumonia. Now this combination, you know, of jaundice and right lower lobe pneumonia, one remedy could be chelidonium. One remedy could be chelidonium. Okay. So we'll go ahead, pneumonia in children and respiratory complaints, which mainly comes after exposure to cold or after suppressed eruptions. And one last situation, very important, is the moment a person enters from open air into a warm room, he might have asthmatic attack. I'll repeat the situation, please understand and tell me a remedy. When a person is entering from an open air into a warm room, he will have a trigger or he might have an asthmatic attack. Okay. The only other remedy is what I want. One remedy I have given you. And this is, I know, because what did you think of was open air. That was deceived, meaning, you know, that statement. Open air and then they enter a warm room. You know the remedy, it's a very simple remedy. When I reveal the answer, you lost feel bad, or at least I assume you will feel bad. It's a very simple remedy. Okay, she is very close. Okay. So the remedy is Pneumonia. The only other remedy. From open air they enter a warm room. Pneumonia. Ailments from getting overheated is what you have in pneumonia. So this is the only other remedy you have. Lobelia. Lobelia, okay? Yeah, asthma entering a warm room from open air. This is how the repertory, in the repertory it is given. Asthma entering a warm room from open air. Now before I go ahead, two very important topics we have covered in Lobelia. One is the GA, and GA, what did we see? We saw mainly acidity, heartburn, and the second very important thing we saw was nausea and vomiting. Okay, nausea, aggravation, hot food. And then the second thing we spoke was respiratory. And what was the first statement I gave you? It mainly is good, it mainly affects the lower respiratory tract. And wherein you have tickling, and then you have cough, or lower down you have asthma. Lower down you have asthma, okay? Asthma associated with all those gastric things. And anxiety related asthma. What we call it as psychogenic asthma. Psychogenic asthma, okay? Pneumonia in children, respiratory. Now the last area, is very important to you. And the affinity of Lobelia on sacrum. If you just see this here, the sacrum. Sacrum. Now what you have to realize here is, there will have pain in sacrum. Now because of this pain, what is the person doing? You can take up from Google images. This person is not exactly bending forward, at least he is not bending back. Okay. He is trying to sit a little forward so that there is no pressure on the sacrum. So this is the situation you have to remember. Pain in sacrum cannot bear slightest touch. Sits leaning forward to avoid contact with bedclothes on sacrum. Cannot bear even a soft pillow over sacrum. Very, very important. Having said this is important, I also have a small question for you. A small quiz. You need to name a remedy which has great sensitivity between the vertebrae, that the patient sits sideways in a chair in order to avoid pressure. See, this you just saw, he is sitting firm so that back will not touch. I want a remedy from you where the person is sitting sideways. Okay? Because the vertebrae are very, very sensitive. So which is that remedy? And this remedy is over. It's done and dusted. Huh? No? Stethoscope? No problem. It's not stethoscope. No issues. Huh? Borax? It's not borax. No problem. Bellis? Bellis? It's not bellis. No issues. Hypericum? Agaritas? Zircon? Okay. So the remedy is you check, Ashwata. The remedy is pterygium, spider, pterygium, very prominent in pterygium. So remember this pterygium and the last component. The last component we'll be taking up is comparison. Yeah, it's a lengthy sentence. You can take your time, make a note. It's given in allowance. It's there in Boric or source book. You have this information given. Okay? So just have a look and we'll see. So acting on sacrum. Remedies acting on the coccyx, hypericum, silesia. There is a condition called as coxycodynia. Okay, bad pain in the tip of the lower vertebrae. Silesia, hypericum. There are a lot of remedies. You go ahead? Yeah. So next is, as a final year student, I believe the more remedies we compare, the more clarity you will have. So what remedies would you like to compare here? We have already done a comparison as and when I was taking the remedies. But respiratory, gastric asthma. I'll give you the symptoms, you name the remedy. Gastric asthma with marked flatulence in old debilitated people. Gastric asthma with marked flatulence in old debilitated people. All keywords, very good. All keywords, it makes sense. And in case if you have not got it, debilitated face. Amplification, adaptation, aggravation, sitting and lying down. And the remedy, as you rightly guessed, it is carbohydrate. Carbohydrate also has gastric asthma. Carbohydrates also acts on the pneumogastric nerve. You see a lot of flatulence, they feel better by eructation, and that face of carbohydrates is very scary, as if there is no life. Any minute they are going to die. Is a look that the patient will be given to you. Okay? Carbohydrates. And second remedy is asthma and fat people. I was quick. Asthma in fat people, constriction in chest, rattling of mucus, aggravation, release motion. Antimplant will come a little later. And it is confusing because rattling of mucus. But before that, we discuss the remedy. Asthma in fat people. Asthma and pneumonia in fat children. Okay. The remedies? Ipecac. Good. The remedies? Ipecac ಅಲ್ಲಿ clean tongue ಇರುತ್ತೆ, deathly nausea ಇರುತ್ತೆ, thirstless ಇರ್ತಾರೆ, chilly ಇರ್ತಾರೆ. Okay, Ipecac, good. Asthma from gastric disturbances after heavy meal, distended abdomen, amelioration, belching, aggravation, cold and exertion. Amelioration, cold and exertion. Very simple remedy. The catch is this. aggravation evening, walking, fast exertion and after a meal. Probably for you this can be a cashier. Aggravation evening and after a meal. After a meal. Pulsator, gastric asthma. And now your favorite remedy, antimonium tat. Now what will happen in antimonium tat? There is death rental, the chest will be full of phlegm, and beautiful remedy. Recently I had an opportunity to treat a child with antimonium. Bad bass, rattling sound. And how do you differentiate other remedies from antimonium is they cling. Clinging especially during respiratory complaints. Antimonium. Okay. Otherwise this child would have landed up in the emergency ward. Thanks to homeopathy, we could beautifully bring the child. He was in a very bad state. Now that we are going for postings, he was in respiratory distress. Against medical advice, parents took the risk of avoiding admission in a corporate hospital because the child was in a bad distress, and thanks to them for having faith in homeopathy, and they said no to admission. They wrote, what is it called, against medical advice, they got discharged, and the child beautifully recovered with antimonium platarica. Bad rails, chest was full of sputum. And again here I would like to bring it to your notice. Please check E.F. Harrington, Clinical Materia Medica. There Dr. E.F. Harrington tells, after you give a right remedy, the child should cough. The phlegm which was stingy and sticky and which was bothering the child, that should loosen up and it should come out. And he also gives a word of caution. If the child is going more into drowsiness, okay, it is a bad sign. You getting my point? Child is going more into drowsiness, the respiratory center is depressed, and is not able to cough, is not able to bring out sputum, but chest is full of phlegm. Going into drowsiness is a bad sign. Must be some lecture he explains, I don't remember. You should be Ipecac lecture. Please read Ipecac lecture in E.F. Harrington. He explains there. So antimonium, lifesaver, you will have to remember. We will come back to the modalities of Lobelia, aggravation, cold, smoking, bathing, okay. Better by warmth. Better by warmth and evening they feel better. Better by rapid walking. What is better by rapid walking? Correct. Asthma or dyspnea, difficulty in breathing, better by rapid walking. So this is in short about Lobelia. Now the final thing that will help you know, or that will help me know how much of Lobelia you have understood. Now what is this? The final component is clinically. Tomorrow, where can one think of Lobelia is very important. So where do you think of Lobelia? Pneumonia, children, gastric asthma, psychogenic asthma, very good, psychogenic asthma, gastric asthma, and amenorrhea, morning sickness, vomiting, pain in sacrum, correct, pain in sacrum, hardness of hearing, very good, hardness of hearing after suppressed otorrhea, very good. So these are few things that you will have to remember. So make a list so that you get a clarity. And if you are worried about exams, the question that can come up from Lobelia is respiratory or gastric. Or action on pneumogastric, where they can ask this for 5 marks. Okay. So any quick questions in Lobelia? If you have any questions, I'll take it up. Leila, clear, and I will stop. some of action is on pneumogastric nerve, GI, respiratory, sacrum. At least these three areas you have to remember and you should be clear.